Hello, I'm Dr. Katipally, founder and CEO of the New Me Health Center, San Antonio's premier lifestyle medicine center dedicated to assisting the patients with the prediabetes and diabetes. We are excited to join forces with the San Antonio Preventive Health Conference and the team who are envisioning San Antonio as a blue zone. That something resonates with our mission and what we are trying to do to our community. Our program focuses on addressing the root cause of these conditions through evidence-based approaches such as whole food plant-based nutrition, regular physical exercise, restorative sleep, and other lifestyle interventions. By implementing these changes, patients can reverse their insulin resistance, improve their blood sugar levels, and ultimately reduce the dependency on their medications and preventing the complications from those chronic illnesses. After years of witnessing how hard it was for the patients to prevent and manage these chronic conditions, it was clear that the status quo must be changed. This challenge led us to our new mission, to transform the lives, not just treat the diseases. We know that each patient's conditions, needs, and the lifestyles are unique. That's why we offer a personalized program tailored to their health profiles, cultural choices, and the lifestyle. We will guide you every step of the way as you reclaim your optimal health and the vitality that you desire and deserve. Ready to embark on your journey to your healthier and happier you? Contact New Me Health. Take the first step toward defeating your diabetes and discovering a new me.
Good evening, everyone. Anyone hear me right? Good. Okay. Thank you, Dr. Harvey. I think thanks for setting the stage. I think it's beautiful. Lots of studies, right? It might look like Greek and Latin, but yeah, there is the evidence. There is evidence of how powerful lifestyle medicine can be. And I'm proud, I'm privileged to kind of represent what we do in our clinic to help our patients in our community. Well, as you can look at the title, lifestyle medicine, I call it a paradigm shift to exit the chronic disease pandemic. I know we had the COVID, but there is the most powerful, even actually a monstrous pandemic that we are living day in, day out. We all think of health. How many wants to be healthy, by the way? Right? If you look at the word health, we can define health in many different ways. And one way I look at it is healing from within. And that's what our ancestors actually taught us. That's how human life was driven and led for generations. But how often are you taking the responsibility and then your innate power to build that and to sustain that health and stay healthy versus putting our health in someone else's hands? This is an amazing mission. We must be blessed and gifted to own this machine called the human body. It's the most fascinating machine in the world and universe. It's a self-healing machine. Health is natural to our human body, and disease is unnatural. All right, I apologize for the sequence, but let's look at the first column right there. How many people know, even heard of those terms? Nyctalopia, or night blindness, Beriberi, scurvy, rickets, marasmus, kwashiorkor. Did anyone see anyone with those conditions or even heard of them? How about tetanus, diphtheria, rubella, polio? We heard of them, right? Did you see any patients with those conditions? Probably not. Because that was the old world. Look at the new world. Do you know anybody who's fighting obesity, diabetes, blood pressure, cholesterol, heart disease, fatty liver, cancer? That's the new world we're living in. Well, you can see that the three pictures right there. The first one, a team of doctors and nurses. They're struggling. I can't keep up. I've been mopping all day, every day. I can't keep up. And the couple in the second picture, and they're asking each other, honey, did I turn off the stove? I don't know where the stove, but you're seeing your kitchen is flooding. And the third picture represents our healthcare system. I call it a medical maze. No one is free. There's something called burnout. Physician burnout, nurse burnout. Doctors are busy, specialists are busy. Your endocrinology, your lab, your imaging system, everyone is busy. Your billing department, even patient is busy. I can't keep up with these appointments. I can't keep up with these bills. Then where is the health, right? Look at the food paradox. In 1920, that's how people used to die. Malnourishment, lack of food and basic resources. 100 years later, that's where we're living. 2020, overfed, undernourished. And what our human bodies are doing is not an anomaly. It's a natural response for overfeeding, for loading your empty calories and lack of physical exercise, thanks to the technology and innovations and all that. But the basic elements of the human nature were actually subtracted and were expected to be supplemented in terms of pills and some other means. It took thousands and thousands of generations or millions of years for that species to evolve from there to there. And you look at the last man on the line, it didn't even take a couple of decades, barely 2 generations. And that's how the human shape was transformed. And that's the shape of the world today. If you look at the world stats, WHO reported back in 2016, 1.9 billion people, that is 1 in 3 adults, were overweight. 1 in 8 were obese. From 1975 to 2016, just barely, maybe not even my lifetime, I would say 3 or 4 decades, the world obesity tripled. What happened? Humans were on this planet for many generations, many years. And if this trend continues, 2025, we're almost there. 2.7 billion people would be overweight, 1 billion would be obese, and 170 million would be severely obese. Look at, as Dr. Harvey was referring to, he was asking, quizzing you all, right? What are the top 10 leading causes of death? Look at that, heart disease, cancer, COVID, that took place out of nowhere, took the 3rd place last year or maybe a few years ago. Your stroke, your chronic issues and all that. So those are the top 10 leading causes of death here in the United States. Look at that. 60 to 70% of those conditions are directly linked to your lifestyle, meaning preventable. We don't have to deal with them. The same study, the global disease burden, global burden of disease study back in 2020, they even used the term called syndemic. We were in the middle of the COVID, and that's when they realized we are dying. Millions and millions are dying from COVID. But the unfortunate, the match, or the triggering force, the people who are dying in ICUs and all was their chronic illnesses, including obesity and diabetes. So they coined the word, they introduced the word called syndemic. Your pandemic going in sync with your chronic disease burden, only to expose the vulnerability of the world and the modern population we see around. And this simple slide, again, top leading causes of death. If you look at the breakdown, the underlying root cause, the black represents the tobacco, and back in 70s and 80s, and I'm pretty sure more than half of the audience can relate to that, there was a huge war against tobacco. So thanks to all the efforts, we don't see that much smoking anymore. But what follows that would be the red zone, the red element, which is nothing but poor diet and lack of physical exercise. Imagine how much portion, how much role it's playing behind all these leading causes of death. The same study actually published exposed something really interesting. We as physicians and the medical and the public health experts and all, we always look at the cause of death, the leading causes of death, right? It looks very intuitive, very exciting, and very realistic. But what they have done is something fascinating. They deep dived and looked at the actual cause of death. And that turned out your lack of fiber, excessive calories in terms of sugars, excessive salt, lack of physical exercise, lack of fruits and vegetables, which you can't instantly or relate to the health and ill health. But it turned out those are the major players. I love this graph. Hopefully you can see that. Back in 1970s, look at the graph right there. Something triggered a disaster. The green line represents the calorie intake. Average Americans' daily calorie consumption started spiking right there, followed by two other graphs. The blue line represents the obesity, and the red one represents the diabetes. Not a surprise, a clear match. I love this poster. The CDC actually released a few years ago, the new abnormal. Look at the size of your meal, your sandwich size, your fries, and your drink back in 1950s versus today. That clearly represent the size of the family. What's the burden? How much obesity are we seeing? That's the world stats. And how about United States? From 2000 to 2018, that's about 15 to 20 years' time, you see obesity increased by 50%, and severe obesity doubled. And back in 2008, that's many years ago, even then, the annual cost of obesity was close to $150 billion. And that's why CDC called it obesity is a common, serious, and a costly disease. How about diabetes? Follows the same trend. Close to 40 million Americans, that is 10%, meaning 1 in 10 Americans were diabetic. But 1/5 of them, 1 in 5, didn't even have the formal diagnosis of diabetes, even though they had it. And during the same time, about 100 million Americans were pre-diabetic, and 80% of them have no idea. In other words, if we stick our fingers, who knows? We may get more than half of us pre-diabetic or diabetic. That's the reality. And the trend continues. And this represents the future of this country in terms of obesity. By 2030, if we do nothing, that's how the maps are going to turn. And look at this, our great state of Texas. By 2030, it's going to be, extremely obese, and we see the trends clearly. And this is for your diabetes. This is the prediction. This is the projection from 2015 to 2030. If we do nothing, if we don't take any action, either public health-wise or individually, that's what's going to happen. So from 2015 to 2030, they're expecting the diabetes cases to go almost 55 million cases. And by 2030, again, the annual deaths attributed to diabetes would be close to 400,000 deaths. Imagine a COVID in there, right? It's in every household. And the cost, in terms of cost, to manage these patients with diabetes would be close to $600 to $700 billion annually. Again, it's hard to read, but this slide actually puts out all those top leading causes of death. Every single disease, this is the annual budget. 80 to 90% of this close to $4 trillion budget, $4 trillion healthcare expenditure is being spent on chronic preventable and mental health diseases. And every single disease is taking a big toll. 100 to 2 to 3, $400 billion every single year. And still we're not healthy, right? Well, we live in this great state, Texas, and Bexar County and San Antonio. Where are we? We're not different. Still, diabetes, cancer, and heart disease are the leading cause of death. And diabetes is one of the top ones as well. And that's how the Texans are dying. The heart disease mortality, and then the cancer deaths followed by the diabetic death. Back in 2020, I know we are in the middle of COVID, and that's when the Bexar County Health Department released some stats. Surprisingly, not just one metric. Hospitalization secondary due to diabetes, we were in the top in Texas, or at least more than the Texas average. And the amputations from diabetes, we were on more than Texas average. And the deaths happening from diabetes were more than average compared to the Texas stats. And now, obviously, as a result, you see more and more deaths from COVID because we own the obesity and diabetes. And this is a little snapshot of your Bexar County and San Antonio. So as you can see, central and south San Antonio is flooded with obesity and diabetes. I think it's going to be hard to read, but on average, males have more diabetes in Bexar County or San Antonio. And from the year 2019 to 2020, diabetes hospitalizations were more than one third, more than 30% in non-Hispanic blacks and close to 30% in non-Hispanic whites. And in terms of deaths, in male, as you can see right there, in non-Hispanic blacks and Hispanics, it was double compared to their non-Hispanic white counterparts, and then it was triple in women. And again, this slide represents that we are leading the pack in terms of diabetes. The Bexar County leads the pack in Texas. Well, this is one of the staggering stats, actually. It's really mind-boggling. Based on the obesity and chronic diseases, 1 in 4 young Americans are too heavy to serve in military. And about just 1 in 4 meet the physical activity requirements or recommendations. And in terms of their fruits and vegetable consumption, 1 in 10 children and adults eat the recommended amounts of their vegetables. And the cost we paid, as I mentioned earlier, it's close to $150 billion towards obesity alone every year. I love this slide because we always talk about longevity or the life expectancy, and we feel proud that our life expectancy is increasing and increasing. But what COVID has done to our country is it surfaced something really undercover. It surfaced our vulnerability. Based on the stats and the trends they were noticing, it was projected that if you do nothing, the life expectancy would actually go down. And some of the stats and experts were actually projecting this generation Americans are expected to live shorter than our previous generation. Again, this might look like a complex or complicated slide, but I love this again. And there's a huge boom and conversation around longevity, right? They're talking about stem cells and all kinds of things to kind of increase my lifespan and all that. But there are two things to look at. Let me ask you this. How many of you want to live longer, meaning more and more years? How many of you want to live healthier? How many of you want both? Well, that's what the box, the rectangle, represents, meaning it's called rectangularization of your lifespan. The bottom one, obviously, the x-axis represents the lifespan, how long you're living, whether you're in the wheelchair or an ICU or in dialysis or some other organ transplant or someone caring for you or maybe comatose just in a vegetative state. Just living longer is not enough. That's actually even more scarier, more painful, right? How about living healthier? That should be the goal. And as Dr. Harvey was representing, actually mentioning about the blue zones, that's the reason why we are here today. That's what we notice in blue zones. They live longer and healthier. Maybe one night, they just say goodbye happily. And that's why we see people who are actually living longer than 100 years old still have no health issues. They're completely independent, they're happy, and they're healthier. So the bottom line is we should not just think about what pill can actually keep me alive. Instead of just adding years to your life, we must think about adding life to your years. And again, I'm going to go back to Dr. Harvey. He was actually clearly depicting this factor. In the midst of all this, the crazy stats and the trends that we're seeing, there is a good news. And here it is. We always talk about healthcare. We got to go to the doctor, go to the hospital, and take the medications and whatnot. Even though 99% of our minds, our lives, filled with healthcare, that just represents 10% of the care that can make a difference. And the next comes the genetics. As Dr. Harvey was mentioning, 10 to 20, that's an arbitrary number. So about 10 to 20% of your life or your disease or your health is actually dictated by your genes. And even then, you can actually undo it and you can actually change the way your body actually behaves through epigenetics, as he was emphasizing. So what remains, what's left over is a big piece, big part of pie. 70% of your health is actually directly linked to your lifestyle, which we think is difficult, and we don't even think about or we don't even care about. Again, it sums up Dr. Harvey's point right there. I love Dr. Esselstyn. He's one of our favorites and role models from Cleveland Clinic. He ran the clinic. He's the first person to launch a program to reverse the heart disease. And that's exactly what he says. Genetics load the gun while the lifestyle pulls the trigger. Meaning it doesn't matter how many bullets are loaded in the gun. If no one pulls, it doesn't do any harm to you. And it's clearly tied to the epigenetics, as he was showing again. I love that cover story as well from Time Magazine. DNA is not your destiny. And again, the next slide actually represents the study done by Dr. Dean Ornish in California. Within a matter of 12 weeks, through diet and these lifestyle changes, exercise and stress management and so forth, within a matter of 12 weeks, more than 500 genes were altered. More than 500 genes were changed the way they're behaving. All the cancer genes were turned off, anti-cancer genes were turned off. You can't do that with any drug, right? There's no computer or the power switch you can do it, but these are real human beings. And these are the patients with the prostate cancer. They were chosen to go through the lifestyle track versus surgery or the chemotherapy. That's one of the fascinating examples of the studies done in epigenetics. In other words, you can change the way your genes are actually behaving. And I go back to what we do, clinics day in, day out. I don't know how many of you are medical professionals here? Any physicians in the office? In the hall? So we talk about guidelines. And of course, patients, we read a lot, guidelines and recommendations, right? Every single guideline or recommendation is, you must try the lifestyle change before you try a pill or a procedure. We don't even give it a second. That's not even on our discussion, right? Why? It has become a lip service. I might just say a word to Mr. Smith or John, right? Hi, you better lose your weight and eat healthy and then do some exercise. But I don't know, doc. I don't know what that means, right? How do you do that? And this is the triangle that I share with my patients all the time. I call it primordial pillars of human life and health. 3 fundamental pillars of your life that dictate everything: eat, move, and sleep, right? We know what you put in your head, makes your mind, but what you put in your body makes your body. In your mouth makes your body. So nutrition, humans are not eating like humans. We humans are not moving like humans. We humans are not sleeping like humans. That's it. The fundamental pillars are disrupted, and we just wonder why our bodies are misbehaving. Because we are living in this, global village, meaning 24/7 on call, either for the job or for your social media or something else. And thanks to this technology, keeping us all the time. And what it does is it disrupts our circadian rhythm, meaning we are not sleeping. There's no dawn and dusk. There's no sunrise, sunset. It doesn't have any effect on our lives or sleep cycle. And as a result, what is at stake? It's our health, well-being, and our basic relations. And this one, it might look like a busy slide, but if you look at the left half, that's where we are. Our current healthcare system, what we are using, or the way it works, is it was designed for the acute illnesses or acute issues. Basically, it's an acute care model. It's the best. If you get a heart attack or a stroke or a trauma, some kind of cancer, you're dying, we have so many technologies and then the drugs to keep you alive. But unfortunately, 80 to 90% of the trouble in the community and the society in our lives is not trauma, is not life-threatening condition right now. As Dr. Harvey was mentioning, don't come to my office. Stay healthy somewhere else, right? Because I'm going to put a stent. That stent may save you today or tonight, but it's just the beginning of a disaster, down the road. In other words, 80 to 90% of the conditions are actually closely, directly linked to our lifestyle. So chronic lifestyle diseases must be handled differently. And that's where the paradigm shift must happen, both in the healthcare and in the community, and we as patients and we as healthcare providers. And that's where the lifestyle medicine comes into place. In other words, it's not a rocket science, it's not a pillar of procedure, it's going back to your fundamentals and trying to use their own lifestyle changes either to prevent, manage, or even potentially reverse your chronic conditions. And who am I to talk about it? Well, I'm one of those physicians, right? I'm proud to serve, work for a university health system for past 15 years. And I had the privilege to lead some of the busiest service lines. We see about 300 to 400 patients a day. That's almost 100,000 visits per year. And that was a huge responsibility and the privilege to manage such a busy service line. But every single day, I would go home with, I saw this guy 3 months ago. I saw him 3 months ago, and he's the one showing up in the ER. If I'm writing the right pill, why is he getting these amputations and dialysis and heart attacks and strokes and all that? Something must be disconnected. And very soon I realized I'm turning myself into one of those patients too, right? Because my weight was increasing, my cholesterol was going up, my blood pressure was going up too. And that's when I had to kind of pause myself and then see something. And then one day, this is my great moment in my clinics actually. In a single day or two, maybe 2 days apart, I had a family. Nobody could sit in the chairs. They couldn't fit in any of the chairs or the equipment, furniture we had. And the other guy comes with this cellulitis. This is the 4th time. I know I can write a prescription, send you to the hospital for IV antibiotics, but I know as long as you sit in that wheelchair, you can't move, you don't change something, this is not going to be fixed. And the other most startling moment was the next morning, I had a patient who had an EKG changes, and I had to send him to the hospital to make sure he's not getting a heart attack. It took about 2 hours. We have standby ambulances, our own ambulances, to take him to the ER from my clinic. And I was yelling at my nurses, why did it take so long to transfer this patient? I'm kind of worried about his heart attack, right? Well, they said 3 ambulances came by left, and we were waiting for the bariatric ambulance. That really shook me up. Bariatric ambulance, wow, bariatric wheelchairs, bariatric beds. Now we need to wait for a bariatric ambulance. And that's when I think I started kind of thinking like, man, you got to take a deep look and then look at the person in the mirror and then do something about it. Very similar to Dr. Harvey's story, I started shifting my diet and doing some exercise. Got my kids on board, my family on board as well, and then signing up for 5Ks and half marathon and so forth. And that's when I lost 40 pounds. My A1C came down, my blood pressure came down, my cholesterol came down, not in a single pill. I was like, wow, okay. So how can we translate this to our patients? I've been preaching my patients every single day, but no one listens to me. Then I realized it's not that easy. Human behavior, right? Change is difficult, especially in this day and age, it's difficult. And finally, we ran a marathon. I had a pleasure to have a great time with Dr. Tahir. He's one of the physicians. We invited him. I call him a living legend because he's a physician. He's almost going to be about to retire in 50s. He got a heart attack, and he had stent in 60s, and then bypass. Then he realized he had to eat differently and move differently and walk differently. So he changed his lifestyle. He was not a walker. He started running. He ran Chicago Marathon, Boston Marathon, Mount Kilimanjaro. So he wrote a book called Open Heart, and the American Heart Association actually gave a special appreciation. So we invited him to inspire me and our community to, as our brand ambassador, to adapt this lifestyle change. So we ran half marathon with him. He's in his 70s and I'm in 40s, so he's like my father figure. So it was a great time. And that's when we decided to launch this clinic called the New Me Health, to exactly do that and then help the patient to take that walk to transforming lives, not just treating diseases. Because without addressing the root cause, you cannot make a dent in any of your health conditions. And it's critical because we need to have a plan and a strategy and a mentor and accountability. These are all the elements that actually plays a key role in human behavioral change. And without doing that, it's hard. So that's exactly what we do. We have remote patient monitoring tools. Your weight, your blood pressure, your exercise, and your everything will be monitored. And we use continuous glucose monitoring as well. So basically, I'm not the one teaching. My nurses or my dietitian, they're not the one preaching or forcing you to change. You see yourself. Little changes that you're bringing up will actually translate into your change in the weight and your blood pressure, your glucose, and that's exactly how we help these patients can transform. In a matter of weeks to a few months, they drop their A1Cs, they drop their sugar levels. That's when we say, John, you don't need these 20 pills anymore. 2 are enough, 1 is enough. You don't need 120 units of insulin, maybe 50 units are enough. So it depends, where you are on the disease spectrum and how engaged you are. But I'm proud of our patients. Every single patient actually deeply engaged and then see the results that they're looking forward to.
Before I conclude, let me share some food for thought. A couple of my favorite quotes. The first one, here it is. One of the ancient Ayurvedic proverbs said, when diet is wrong, medicine is of no use. But when diet is correct, medicine is of no need. This is Michael Pollan. If you don't know him, he's one of the very highly respected medical journalists and writers. In his book, In Defense of Food, he actually summarizes, actually boiled down the essence of what to eat and how to eat in just 3 words. He says, eat food, not too much, mostly plants. Eat food, not too much, mostly plants. Because almost 90% of the food that we find in our marketplace today is not safe for human consumption. It's the disease-promoting food that you see on the shelves today. And he says not too much. Eat food, real food, not too much, meaning listen to your bodies. When you feel full, stop eating and eat mostly plants. And finally, this man, Thomas Edison. Over 100 years ago, he said something very simple. His simple message lost in time. And what Edison said was the doctor of the future will give little medicine. The doctor of the future will give little medicine, but interest his patients in the care of human frame, diet, and in the cause and prevention of disease. That's why we believe lifestyle medicine is the way forward for both the disease prevention and reversal. And I firmly believe that lifestyle medicine is the inevitable antidote to the chronic disease pandemic that the whole world is witnessing today. And finally, feel free to share this QR code, scan this barcode, or share this website, newmehealth.us. You can reach us out through that website, and feel free to share it with your friends and family. You can schedule an appointment or a free consultation to assess where your diabetes or prediabetes or any other lifestyle diseases that you're fighting today, and make a consultation to see if you can take advantage of our program. Thank you.
And then finally, I'm going to close with this slide. While we are trying to help the patients, one patient at a time, I'm proud of the team, coming from here, Dr. Ocheri and the wonderful team. They're actually embarking on this grand vision, envisioning San Antonio as a blue zone. It's a huge, daunting vision, but together, we can do it. Thank you. All right. Thank you, sir.